Vaccine makers and infectious disease experts here and abroad agree that vaccine efficacy generally wanes over 6 to 8 months based on studies conducted. Hence, healthcare and frontliners in the A1 group who received their jabs in March this year are enjoined by government's pandemic response team to get a third or booster shot for good measure. PTV correspondent Luis Erispe has the latest on the push for booster shots in this report.
The vaccine experts panel in the Philippines says that in the beginning of the month of October, the efficacy of COVID-19 vaccines administered on health workers in March this year may weaken. This based on results of their study showing that the vaccine's potency starts to wane or weaken 6 months to 1 year after administration, depending on brand. That's why the VEP is strongly recommending to give booster shots to health workers as they are the most vulnerable to exposure to the virus and that the healthcare system depends on their safety and good health. And today, presidential spokesperson Harry Roque confirmed that the IATF had talks on the issue of booster shots and that this was already approved for recommendation.
Well, multi-academic na po yan kasi nabalitaan ko naman na nagdesisyon na po ang NITAG, yung ating mga eksperto sa bakuna na magbibigay po ng booster shot sa mga health workers.
On the other hand, the National Task Force sees these booster shots can be administered starting next month, just enough time to boost the efficacy of the vaccines for the A1 priority group.
Pagka once na, nakita natin na sizable na yun natin, maybe by end of October, we can start siguro by end of October or November.
Vaccine SAR Carlito Galvez Jr. assures there will be enough supply of booster shots for the health workers.
Huwag mag-alala ang mga healthcare workers, just in case nag-decide ang DOH at saka WHO to start with the booster for the healthcare worker, we have more than enough vaccines for them.
Meanwhile, despite government officials' confirmation on recommending the booster shots, the Department of Health released a statement that the decision on this has not been finalized by the DOH, NITAG, and all the experts group just yet.
Initial ng NITAG is mauuna muna yung dependence ng A1 na mga healthcare workers. Second, yung mga may comorbidities. Ang unahin muna natin yung 12 and 17.
Luis Erispe for The Nation.